us today. Thank you, Saeed. Again, thanks everyone for joining us today. Welcome. My name is Jenny, and I'll be your facilitator today, walking you through this new HRSA data collection platform. And this webinar is geared for the Black Lung Clinics program, or BLCP grantees. So we're going to be showing you this new system where you'll be uploading your performance report to be reviewed by your HRSA project officer. So as I mentioned, I'll be your facilitator. I also have some of our project team and some of our program representatives who are going to be helping with questions and doing some introductions. So with that, I will hand it over to Anna, if you'd like to say a few words to welcome everybody.
Hi, everyone. Welcome to the webinar. Thank you, Jenny. So just wanted to sort of put a face to the name. My name is Anna Fines. I recently sent out an email introducing myself as your new project officer. So now that we're all together, kind of wanted to introduce myself again. So as your new PO, I'm here to help. Please reach out to me if you have any questions at all. I'm really excited to start working with everyone. And I'm also really excited to roll out our new data collection platform. So I hope that everyone finds this webinar incredibly helpful.
Right. Thank you, Anna. So with that, we'll go ahead and get started. Just a couple administrative details first. So we will ask everyone to stay muted for the first part of the presentation to make sure we can get through everything. If you have any questions, feel free to use the chat box. You can pop that out from your toolbar, and you can put questions in there at any point. We have several different people who are going to be monitoring that, so they can answer questions in real time. We'll also have time at the end of the session to answer any other questions through the chat, or if you want to unmute yourselves at that point at the end, we can do that as well. So again, feel free to put questions in chat as you go through if you don't want to forget your question, or you can hold on till the end and then unmute yourself and we can go through any remaining questions. As we mentioned, we're going to walk you through this new HRSA data collection platform. We know this is a new system, and this is where you're going to be completing or uploading your performance report. And we'll talk about what's changing and what's staying the same in the process for your performance reports. And this is going to be replacing the older system that you've been using in the past if you had BLCP grants from the EHBs or electronic handbooks, the PIMS system. As we go through, we're going to walk through some screenshots of the system so you can get an idea of what it looks like. And then we will also go through an actual demo in a test environment so you can see what it really looks and feels like as you log in once your performance report or reporting period opens up or submission period, sorry, your submission period starts to be able to put that in there. So we'll have screenshots as well as a live demo. I am going to be using a test environment, so I'll have some slightly different information or some additional information than you may see when you log in. But when you log in, you'll only see your program and your grant that you're associated with. And again, we'll answer all your questions at the end, or you can put them in the chat box and we'll have some people monitoring to be able to answer as we go. So for our agenda today, we're going to start with an overview of the changes and who's affected as we move over to this new HRSA data collection platform. Then we'll take a brief look at how the RHDT, or the Rural Health Data Tool that you've been using, how that fits into this new process. We'll take a look at how to access the new data collection platform. And we'll look at the homepage so you know how to navigate through and get to the important information. We'll also take a look then, most importantly, at how to complete and submit your performance report. And finally, how to track the review from your HRSA project officer and see the different statuses and once it's been approved. We'll also take a look at change requests as well as your reports. And then again, of course, questions at the end. So with that, let's get started with our overview. Again, as I mentioned, this new data collection platform is going to be replacing the electronic handbooks, or the EHBs, where you had previously submitted your PIMS performance report. So this new system is gonna hopefully provide a better user experience. It's gonna be easy to navigate through, very simple to track your progress of your performance report and be able to communicate with your project officer. Again, today we're talking about our BLCP grantees. So for you all, we have your, this will apply to any performance reports that are created on or after August 1st of this year. So that's going to go for your reporting periods from July 1st, 2023 to June 30th, 2024. Your submission open date will be August 1st, and then your report will be due at the end of August on the 31st. So you'll have a month to get that data uploaded into the system and then reviewed by your project officer. And before we get into this new data collection platform, just want to mention that Rural Health Data Tool, the RHDT, that you all have been using. So your process for using the RHDT is not going to change. Before you upload your organization's data into this new data collection platform, you'll still need to import the patient level data, the CSV file, into the RHDT and then generate a JSON file. So that process is going to be exactly the same as what you have been doing in the past. Nothing there is going to change. You'll still do that. Once you have that JSON file generated, you'll be able to upload that into the data collection platform. And that's what we're going to show you today, is the process for uploading the JSON file and tracking the progress of your performance report once you've uploaded it. We will share these slides after the webinar, as well as sharing a recording of the webinar. And within the slides, we do have some links to the RHDT user guide. So again, nothing there is changing. That's exactly how you've done it before. We just linked the existing user guide into the slides so you have it for easy access if you need a refresher from your last performance report. Okay, so move on from there. And now let's take a look at this new tool. First off, how to log in. When your performance report submission period opens on August 1st, you'll get an email notifying you that your performance report has been created in the new system. And that email will have a link to the data collection platform. And that link will take you to a two-factor authentication and login.gov page. And the nice thing is, although this is a separate system than the EHBs, you'll actually be using the same login.gov and two-factor authentication process that you have done in the past for the EHBs. So while they're different systems and you won't be logging into the EHBs for your performance report, you'll still be able to use that same login.gov email address and two-factor authentication that you set up for your EHBs. If for whatever reason you haven't been in the EHBs in about the past year, you may not have a login.gov account set up for the EHBs yet. In that case, I recommend you go ahead and set that up before your performance report opens in August. And so if you need any help with that login.gov account setup, we have some wiki pages for the HRSA wiki that can walk you through the process to create your login.gov account. But assuming you already have one, you'll be able to use that on August 1st once you get that email with the link to let you know your performance report is ready to be worked on. Okay, so once you've logged in, you're going to land on our data collection platform homepage. And this is going to be kind of your main landing page as you're working through the system. And over on the right side, you're going to have your username and a drop-down menu that'll let you log out of the system or also come back to this homepage. On the homepage, just gives a little bit of information about FORHP, about the data collection platform, and about your performance reports. And you also have some helpful tabs across the top of the page, as well as some widgets or kind of helpful cards in the middle of the page. bottom section to go to your CBD. Have the option to go to data extracts, and that's going to take you to your reports. And then you also have a help link that's going to take you to user guide and FAQs to give you some support as you're working through the system. All right, now let's get to what you guys really want to see is how to complete and submit your performance report. Once you click on that CBD performance report tab, either from the top navigation bar or from the widget on the bottom of the page, you're going to land on your performance report list page. And this list view or list page gives you different view options that you can see information about any of your performance reports that need to be worked on. And so on here, you'll be able to see and access the tracking ID, which is an auto-generated number when your performance report is created in the system. You can view the submission status. You can view the submission name, the grant number, the program number, the reporting period, and the status for the performance report. So most helpful here, we have, of course, the status for your performance report, as well as that tracking ID. Before we go into the performance report, as I mentioned, there's different list views that you can access from that page to view your report and see what status it's in. So you have approved reports, you have change requested, in progress, recently viewed, and submitted reports. And you can access the different reports by using the arrow next to the report view that you're on, and that's going to bring up this list view option, and you can select which you want to use. The system is going to default to recently viewed, but if you want to always go to your in progress reports, you can use the pin icon, and that will allow you to pin that as your default. So when you come to this page, it will always default you to your in progress reports. You can also use the search text box to search for a particular performance report. And just to go over briefly the different statuses. So we have approved reports, and that's going to be your performance report that has been received by the HRSA project officer or PO, and they've approved it. So that is going to be anything that's in approved status. We also have change requested reports, and those are reports that your HRSA PO has requested updates to. So they've reviewed it and they've sent it back to you requesting changes. So those are going to be in change requested status. Next, we have in progress reports. And those are reports where you as the grantee has either not started the performance report or have started it and are still working on entering data. So it's still kind of in your on your side to finish and then submit once everything's completed. So these are going to be either not started or in progress status. We also have recently viewed, and as I mentioned, that's your default view. And those are performance reports that you have viewed recently, and those can be in any status. Last, we have submitted reports, which are pretty self-explanatory. That is going to have any report that you have submitted to the HRSA PO, and they are still reviewing. So they haven't made a decision either to request changes or to approve yet. And those are going to be in submitted status. So from that list view, once you click on the tracking ID, it's going to take you to your performance report page. And this gives all of the information, and it's kind of your main landing page as you're working on your performance report. So up at the top of the page on the left side, you can see your tracking ID. Again, this is just an auto-generated number once your performance report is created to be able to track it within the system. Then you'll have a section that has grant information. This can be expanded or collapsed based on how much detail you want to see. So it'll have your grant number, your grantee name, the reporting period, as well as the review status, your submitted date, report due date, and then current reporting period. Moving down from there, we have our grantee data entry section. And this is where you'll actually work on uploading your JSON file. So within this section, you can easily identify the status that your report is in or your form is in. And so you have not started status with a red circle. We have in progress status with a kind of orangey yellow clock. and then completed status with a green check mark. So you'll be able to see that next to your patient level data upload form. You also have the option to view if you want to view the form, or edit when you're ready to work on uploading your report. And down at the bottom of the page, you also have approval history. So once you have submitted your report for approval, this will generate with information so you can track the status, and we'll look at that kind of as we go along. Okay. All right, so once you click on start or edit for your form, your patient level data, you'll go to the public burden statement first, and this just gives some background information about the program. Once you read that, you can click the next button down on the bottom right side of the page, and that's going to take you to the next part of your report. And this is where we get into uploading that JSON file. So again, before you even come into the data collection platform, you'll want to make sure you have that JSON file generated from the RHDT so that you can upload it once you get into the data collection platform. So the top section of this form, the patient level data upload, gives some information and kind of tips and helpful details about uploading the data. So I definitely recommend you'll want to read through this when you first go into the system to make sure your uploads are going to meet all of the requirements. And there is, within the system, there is a helpful link to the BLCP field validation rules right in like the second sentence here. So definitely use that. That's going to help guide you as you are putting your data into the initial file that you turn into a JSON. So that's going to make sure that the type of data that you enter is correct, whether it's, say, something that needs to be a whole number, like number of people, or it could be a number with a decimal point. That field validation rules document is going to give you the guidance on the type of data for each of the fields to enter. Okay. So moving down, at the bottom of this instruction section, we also have information about the different statuses that you may see while you're uploading your file. So we have processed, and that means that the file has been uploaded and processed successfully into the system. And there's no validation errors, which means all of those field validation rules have been met, and everything was able to upload into the system. We also have process with errors that you may see, and we'll look at that a little bit more. But if you see that, that means something with the field validation rules did not match up when you uploaded the file. So you'll need to take a look at the error file and see what needs to be corrected to upload your file again. And last, we have pending, and that's just going to show while the file is being uploaded into the system. Sometimes it may take a little bit, and that's going to just be the indication that the system is still working on uploading and processing the data. Okay. So moving down, we have that header again. And that's going to show, if you expand it, it's going to show you the grantee details and information. We also have the file upload section. So this is going to be where you're going to upload that JSON file that you created from the RHDT. And that's going to allow you to then upload the file into the system so that it can be processed. Again, the file must be in JSON format. If not, it will not upload correctly into the system and you will get an error message. So make sure you are uploading a JSON file. If you're uploading a very large file, you may also get an error message. In that case, you can split the file into the patient data and the encounter data when you put it into RHDT to get two separate JSON files. Okay, all right, let's look a little bit more at uploading the file. So once you've uploaded your JSON file, you're going to see the different statuses, which I mentioned. So we have processed, which again means that everything met those field validation rules and was processed into the system. And you have the option in that column to be able to download the file. So that's going to be able to allow you to download the file that you just uploaded. You need to get a copy of it. If there was something wrong, again, something with that didn't match those field validation rules, you're going to see the process data or process with errors. So that still means that the data uploaded into the system, but there were some errors. So you can click on the view errors in the errors column, and that's going to show a list of any of the errors and what was wrong so that you know how to make those corrections. Okay. Next, moving down the page, after you've uploaded your file and had a successful file process, then you'll be able to see data within or information within the data summary section. So here's where you will be able to see the clinic name, the clinic site ID. You can see the minors in the clinic and have an action option to delete the file if you'd like to remove the file. So that delete option, which is the trash can icon, is going to delete the updated or the uploaded information. And please take note that if you click on the delete icon, that's going to remove all of the specific client site related information reported on the current report. So that will delete this information. The file will still remain. However, the information in the data summary will be deleted. So you would need to update or upload a new file. Okay, and just a few other helpful tips as you are reviewing this information and uploading your files. So you can upload a JSON file as many times as you need. Each JSON file can contain patient level data for individual clinic sites or across multiple clinic sites. So you can upload as many as you need. Patient records for the clinic sites that were not uploaded earlier will be added into the system. So if you uploaded one file and then uploaded a second that had additional patient records, those are going to be added into the system in addition to what you already had. And then we also have a situation where the patient records for clinic sites that were uploaded earlier would be deleted and replaced in the system with patient records for the new JSON file. So what I mean there is that basically if you already uploaded data that included a certain patient data for a clinic site and you upload a second file, then anything that was duplicated would be replaced by the data from the second file. Anything that was not duplicated will still remain. And so you'll have new data added in there, but if there's anything for the same patient or same clinic site, that is going to replace what was originally entered. Okay, hopefully that makes sense. If you do have any questions on that, please put that in the chat or ask any additional questions at the end. I know that might be a little bit confusing, but basically it will override any duplicate data, but then also add in any new data. So hopefully that makes sense there as you're working with files. And this is the same as what you would have seen happen in the previous system. So no changes there as to how the information is updated and uploaded. Okay. Okay, so after you have successfully attached your JSON file and you've reviewed all of the information in the data summary and made sure everything looks correct, then we're going to continue moving down the page, and we have the Rural Health Data Tool Disclaimer Policy. So there's a link there for you to click on and click on the word here, and that's going to bring up a disclaimer policy for you to read. So you want to make sure you read that, and then once you have read that, to agree to that, you have a certify statement to certify that you've reviewed the data report that you've updated, everything is correct, and you understand and agree to the disclaimer policy. So you'll check the box next to the certify statement to verify and certify that. And then once everything is uploaded and verified and you are ready to go, you can mark this form as complete by checking the box next to mark form as complete. And once everything is in there, you'll come down to the very bottom of the page and you can click next. And this is how you save your data. So one thing to note is that the system does not autosave. So if you've put in some of the information and uploaded a file, but not clicked save, or sorry, not clicked next, and you go back or the system times out on you, then it will not save all of the information. So just make sure that you are clicking that next button and you don't accidentally click previous, because we don't want you to lose any of your information that you've entered into the system. Right. All right, so once you've marked everything complete and clicked next, you're going to come back to the performance report landing page that we were looking at before. And your form or data upload is going to be in complete status now. You'll also have the option now to submit for review on the top right side of the page. So from before, when you initially came and the upload file was, or the upload form, sorry, was in not started or in progress status, you did not have a submit for review button. But once everything is complete, you'll have that submit for review button, and that's what's going to submit it to your HRSA project officer or PO for them to review. Once you click on submit for review, you'll have a pop-up window, and that's going to allow you to add any comments that you'd like to send over for your HRSA PO. These are optional. If you want to add comments, you're more than welcome to. If not, you can just click submit, but you do want to make sure you click this kind of second submit button, because that's what's going to actually submit it to your HRSA project officer for them to review. And once you've clicked that submit button, again, it's going to submit it to your HRSA PO, and then your report will automatically move into submitted status. And then you'll be able to find it on your submitted reports list view. So that kind of ties us back to those initial different list view options I was talking about at the beginning. And you'll see the submitted report on your submitted reports list view, and you can see the status would be updated to submitted. All right, I know that was a lot of information, so I'm going to pause for just a second, see if there are any questions before we move on to checking the statuses and approval history and everything. So I'll pause for just a second here. All right, I don't see any questions coming in, but just remember, you're welcome to use that chat if you want to ask questions. And we'll also give time at the end if you want to unmute and ask any questions. Now we're going to take a look at the approval history and approved reports. So for your approval history, as I mentioned in the beginning, initially this will be blank. So this is on your performance report landing page. And once you submit your report, then this approval history will generate, and you'll be able to see when the report was submitted, who submitted it, and any comments that were added when it was submitted. This is also where you can track if the HRSA project officer has requested changes. This will will generate and show you the change request status, as well as the comments that the HRSA PO added. You would need to make changes. We'll talk about that a little bit more in a second. And if you resubmit it, then once it gets approved for your report by your PO, you'll see approved status, and you know that everything is complete and has been accepted into the system. Within the approval history section, you also have the option to expand the arrow on the far right side next to comments, and that's going to allow you to view additional information, because it will automatically just shorten the comment section, but you can expand that if you need to view longer comments. And once your report has been approved by HRSA, it's going to move to the approved report status or approved status, and that's going to show in your approved reports list view. And you can access a read-only view of that through clicking on the tracking ID on the approved reports page to view that information. Now we'll take a look at change requested. I mentioned this just a little bit as I was showing you the different statuses. But once you submit your report to your HRSA PO, if they review and realize that some changes need to be made, they can send the report back to you and request changes there. So if that happens, you'll get a notification and you can find your report in the change requested reports list view. You'll see change requested status on the right side. You'll go in and you'll click on the tracking ID. Once you click on the tracking ID, that's going to take you to your performance report landing page. And you'll be able to click on the edit option and make whatever changes are needed, whether it's uploading a new file, whatever needs to be changed to meet the request from the HRSA PO. Down in the approval history, again, you'll see change requested, and your HRSA PO will add comments on exactly what they notice that needs to be updated. Once you've made the changes that have been requested, then you can go up at the top again of the page and click Submit for Review. And that's going to allow you to resubmit this for your HRSA project officer to review. So it is really important that you make sure once you address any changes, you submit that for review again, because otherwise your HRSA PO will not know that it's been updated and they won't be able to review it again. So make sure once you address any changes, you click that Submit for Review button again and submit it back over to your HRSA PO. Okay. I know that's a lot of information, but now let's take a look at what this looks like in the system. And I see some people adding some helpful information in the chat, so appreciate that. Let me just get logged in really quick. Sorry, it timed out on me. Bear with me 1 second. Okay. Take this time. If you do have questions, go ahead and put them in chat. Let me just get back in. I apologize, it timed out. Sorry about that. Okay, I think I am in. All right, here we go. Ooh. Okay, sorry about that. Okay, so once you log into the system, again, you're going to land on this data collection platform, our main landing page. And as I mentioned, you have your username up on the top right side of the page, and you can click to expand to either go back to the home page. So from anywhere in the system, you can get back to this home page, or you can log out. We also have those top navigation bars, so you can click the little home option and the house, and that's going to take you back to this main home page. You can also access your CBD performance report, your data extracts, your reports, or your help materials from the top navigation bar or from the bottom section with those corresponding options. So I'm going to go ahead and click on the CBD performance reports option. And that's going to take me to our list view. Again, this is just test data, so it's not real information. And I'm going to have several options here so I can show you different information, but you would just have your grant and your performance report listed. So just to go over those different list view options, again, it's going to default to recently viewed when you go to this page. But if you click the arrow next to the list view, you can select approved reports. You can select to view change requested reports, in progress, recently viewed, of course, or submitted. I'm going to go ahead and click on in progress reports. And if this was the page that I always wanted to open when I click on the CBD performance reports, I can use the pin option, and that's going to pin this as my default view. So then anytime I go and click on performance reports, that's going to open to in progress instead of the system default of recently viewed. So you can use this if you have a specific view that you want to always see when you go in. You can still change it. You could go back. If you want to go back to recently viewed, you can select that and then pin that if you change your mind. So on the list views here, again, we have the tracking ID. You have your submission status, so you can see if it's on track, which means it's still within the due date for the submission. If it's past due, meaning you've passed the submission due date, which in your case would be August 31st, it's going to display past due here, so you can easily see what you need to work on. You have your submission name, your grant number, your program name, your reporting period, and your status. So I'm going to go back to recently viewed. And I am going to go ahead and click on my performance report that I have that's in not started status. So I'll click on the tracking ID. And that's going to take us to the performance report landing page. So at the top, you have your tracking ID, and then we have the grant information. So if you click the arrow next to the grant number, it expands so you can see that additional information. Again, this is all test data, but you can see the reporting period, when the report is due, review status, the submitted date, which will populate once you submit it, and the grant information. So I'm going to go ahead and collapse that. And then moving down, you have your grantee data entry section. And this piece is where you're going to click to upload your data. So again, you have your view option and you have start, or once it's in progress, that would show edit once you've been in there before. And then down at the bottom of the page, you have approval history, and that will generate once you submit your report. So I'm going to go ahead back to the grantee data entry section and find my form, which again is in not started. I'm going to click on start. And that takes us to the public burden statement. So when you first come here, you'll want to read this information about the Black Lung Clinics program. Click next once you've read through that information. And that takes us to Form 1, which is the patient level data upload. Again, at the top of the page, you have all of the helpful instructions about the file. You have your BLCP field validation rules, which again is going to be very helpful when you are populating the data for your reports. So make sure you use that information. That'll help you make sure all of the data is entered correctly. You also have the details about the different statuses while your file is being uploaded, so you can view that. And moving down, we have that grant information where you can expand or collapse that. Then we'll get down to uploading the file. So you have your file upload section about halfway down through the page, and you'll click on upload files. And I apologize, I should have had this prompted up to my file. Give me 1 second. Let me find my file. So this is where you're going to populate the JSON file or upload the JSON file that you generated from the RHDT. So again, you can, you'll want to make sure you have that file handy and to be able to upload the JSON file. So I'm going to upload a file, and the first one I'm going to upload is actually going to be just to show you what an error looks like. Hopefully you all won't have any errors in your files and everything will look good, but I just want to show you what that would look like if there happened to be an error. So you'll see the file uploads once you select it, and you'll click on done once you have the green check mark and the status bar is complete and shows file 1 of 1 uploaded. I'm going to go ahead and click done. And that's going to bring it up into the system, and it's going to show pending while the file is uploading and processing. This can take a little bit of time, especially since I'm in a test system. So here we go. So again, I uploaded a file that has an error in it. So this had an error with the clinic site IDs. And you'll see in the file status, it has processed with errors. So we know that it uploaded into the system, but there were some errors that didn't match with the field validation rules. And what you can do then is click on the view errors file in the errors column, or view errors option in the errors column. And that's going to generate this error message, and it's going to explain that basically what was missing or incorrect in your upload. So for this case, as I mentioned, it did not have an accurate value for the clinic site and field. So that's okay. I'm going to close. And I'm going to upload a new file. So again, hopefully you won't get any errors, but just in case. Error message. You also can download the error, and that's going to download the error file in Excel. And you'll see up here, I have it popped up, and I can open my file and see it in Excel format. And you'll see again, it opens in Excel. So if you'd rather download this so you have the file or the error information when you go back to upload your file or re-upload your file, you can easily see without having to be in the system. So you can definitely use that download option to get that error in an Excel format. Okay, and then we can close that section, and I'm going to upload another file. And so once you upload your file, let me show you this. So we have our file. I'm just going to click open, and it's going to upload that again. So this is a new file. And again, you can upload the JSON as many times as you need. And now we'll see my new file uploading here. It's in pending status. And hopefully this one will process correctly. You never know in a test system. But again, if you have additional data later that you need to add, you can always upload additional JSON files if you need to. So this one is showing as processed. So it did process correctly into the system, which means, again, there was nothing found that went against the field validation rules. Obviously, we want to make sure you are double checking the actual data and numbers that you put in. This is just checking to make sure it meets the kind of format and general validation rules within the system. So now that I have my processed file and everything looks good, I can come down and I can look at the data summary. So this again has your clinic name or names, the clinic site ID, the minors in the clinic, and then the action. So if you needed to delete one of these, you could use the trash can icon and delete that. Continuing on down, we have the Rural Health Data Tools disclaimer policy. So you'd want to click on that policy, review that. And once you've reviewed it, you'll click on the certify button. And that's going to certify again that you verified all of your data is accurate and you agree to the disclaimer policy for the RHDT. Once you've done that, and again, you've triple checked all of your information, everything is correct, you can click on Mark Form as complete, and that's going to allow you to complete the form. If you're not quite ready to complete it, you can save the information just from here. You don't even have to necessarily click that, but you could save by clicking next. And that's going to move your form into in progress status. So if you need to verify anything before you submit it and before you certify, you can save it while it's kind of still being worked on. So I'm going to go back in and I'm going to come down and I'm going to certify and mark it as complete. And now when I click next to again save all the information, it's going to take me back to the performance report landing page, and my form is now in complete status. So it's got that green check mark next to it. Since the form is now complete and the data has been uploaded, I finally have the option here to submit for review. And again, this submit for review button is not visible or clickable until your form is actually in complete status. So you aren't able to accidentally submit it before it's complete. But once you have your form completed, you'll click on submit for review. Again, you can add optional comments that you want to send to the HRSA PO. And then you'll click submit at the bottom of the pop-up window here. And once I submit, you'll get a success message. And we come back to the performance report landing page, and now the approval history, when you expand that, shows that it's been submitted, shows the date and time, and who submitted it, and then the comment. So I added that comment to please review so that that is visible there as well. So now once I come back to my performance reports list page, if I go to submitted reports, the report that I was working on is now listed in submitted status here. So we know that it's been submitted to the HRSA PO and they are working on reviewing the data. And once they review, if they request any changes, the report will come back into your change requested list view here, and you'll be able to take a look, review anything. And give me just 1 second while I'm getting it moved into change requested status. Okay, let me just come back. So once they've reviewed, if it's in changes have been requested, again, you'll get a notification and you'll see your report in the change requested reports section here. You have change requested status and you can click on the tracking ID. And you'll be able to see, oh, it looks like it didn't update. Apologize, test system issues here, but it would be updated and show the change requested comment and status that the HRSA PO or project officer put in there. So you'd see the change requested there. I think maybe it just didn't quite upload or update yet. But once you come in and you address any of the concerns that the HRSA project officer had, you would click back through your performance report. And once you've made any updates that you need to, you can submit the report for review again. Once you've submitted it, you can send, or once you've made the changes, you can add comments. Sorry, I can't type and talk at the same time. And send it back to the HRSA PO. I'm going to resubmit it to them. And here we go. Now it's updating. Okay. Just took a second for the system to catch up to me. So we can see in the performance report landing page under approval history, you have where we initially submitted it, where the HRSA project officer sent the change request and they added comments. And again, if there's long comments added, you can use the arrow next to comments to either do clip text, which shows just the short version, or wrap text if there's longer information typed in. And then I resubmitted it after making changes. And so you can track that approval history there. And once your HRSA project officer has approved the report, which I have my magical help behind me here, approving and change requesting for us. So once the HRSA PO reviews and everything looks good, you will be able to see your performance report in the approved status list view here. So you can again see and click on the tracking ID to see the information. You can see approved so that you know that everything has gone through and is good to go in the system. All right, I'm going to pause there before we move on to the reports and see if anyone has any questions before we keep moving along. All right, we'll keep going here. So we're going to move on to our reports. All right, so for the reports, to access those, you'll click on data extracts, either from the top navigation bar or from the widget on the home page, and that's going to take you to your reports page. It's going to default to to recent reports. So obviously the first time you log in, there won't be anything here because you won't have had any recently viewed reports. So our recommendation is to either go to all reports or go to all folders. And that, if you do all folders, that's going to show the two separate folders of data that we have. So it's going to show the aggregate encounter data and the aggregate patient data. You can also see who created the folder, when it was created, who last made changes, and the modification date. If you go ahead and click on one of the folder names, that's going to show all of the reports within that folder. So we do have a lot of reports, and that's why split up and maybe easier to navigate and find the data that you need just by starting with either encounter or patient data. So once you select the folder you want to view, you're going to see all of the reports listed out in that folder. So I had clicked on the patient aggregate data, and that's going to show me all of the different patient reports that we have options for. You can click on the report name in the name column, and that's going to open up the report. You also could click on the folder, and that's going to take you back to the folder for those. And on the far right side of the page, you'll have the option to click run or export the report. Once you click on a report name, that's going to open up the actual report so you can view the data within the report. You have options to export to Excel or to another format. And down in the bottom, you can scroll left to right if there's additional data that you want to be able to view. And we also have down on the very bottom on the left side, some different options of how you want to view the information. So if you want to view it in detail view or not details and more of a summary view, you can view subtotals, row counts, lots of different options to be able to view the data in different formats. Okay, so if you click on export, if you want to view this report outside of the system, you can click again that export option, and that's going to give you two different options to view and download the report. So you can do a formatted report, which is going to be in Excel and XLSX. And once you select that, then you'll click export, and that's going to export your report into Excel format. And then you also have the option to export it in details only. And that gives you several different options for the format as well as the encoding. We'll look at those in just a second, and then you can click export, and it's going to export your file. Okay. All right, so let's go ahead and take a look at the reports. So again, I'm going to come from my home page. And once you select data extracts, either on the top navigation bar or down on the bottom of the page, you can open your reports here. Again, first time you come, it's going to be blank since you don't have any recently viewed reports. And you can either select all reports. And give me 1 second. So we got folders, let me see, sorry. Test system, sometimes it decides to refresh and not add everything in. Bear with me 1 second. Okay, give me 1 second. It looks like this person I'm in right now does not have my report information. So give me 1 second. Let me log in as a different user. I apologize. If you do have any questions, please take this time to go ahead and enter those in the chat, and I will get logged in as another user. All right, bear with me just a second. I apologize. Sometimes our test systems refresh, and so let me see if I can get a report in here. Okay, let's see if this here got some reports here. Okay, perfect. So this user, I apologize everyone, but we're back, we're good. So this user does have my reports, and you will all have access to these reports. Again, I'm just using some test data, so sometimes it gets refreshed as we're working on the system. So once you're on your data extracts page, you can either click on all reports, and that's going to list, that's going to list all of your reports that you have available to you. Or if you want it a little bit more organized to search for your specific report, you can click on all folders and you can either go to the encounter data or the patient data. I'm going to go ahead and click on patient data. And that's going to bring up all of my patient-related reports. Again, you can kind of drag these if you need to be able to see more information. You can drag the column headers. So we have our name where you can click on the report to view it. You have a description of the report, that folder. So if you want to go back to the folder it's in, you can click on that, who it was created by, and when it was created. I'm going to go ahead and just click on the BLCP aggregate patient data or patient age, sorry. Once you click on that, the report is going to open. So you can view all of the information for that particular report. And you can scroll down. You have the options to scroll top to bottom as well as left to right for reports that may have a lot of columns and data fields. We also have options down at the bottom of the page where you can toggle kind of on or off the row counts, the detail rows, subtotals, and grand total. And up on the top right side of the page, you can also click export. And that is going to take you to your export options. So you can either export the formatted report in Excel format, or you have the details only option, where you can select either Excel XLS, Excel XLSX, or comma delimited, which is the CSV file. And you have different encoding options that you can select as well. And then once you select your view, you can click export and it's going to generate the report in the format that you've selected. Okay, so that's our reports. Again, you can go from the data extracts. And now that we've viewed a couple reports or a couple different pages, now when I go in my recently viewed, it's gonna populate those reports. But again, you can find all of them through all reports or all folders. All right. And actually, before I leave this page, I also just want to briefly show you the help materials. So from the top navigation bar or the main landing homepage, you can click help. And that's going to take you to our help page. And this gives you the information if you need to reach out to the HRSA Customer Support Center. It gives you the the phone number, or an option to submit a help request ticket. Moving down from there, you have our user guide sections, and this will be updated to have the user guide specifically for BLCP grantees. So obviously that's not in there yet, but by August 1st, when your reports open, you will have the option here to find a user guide specifically for you all with all of the information we went over today. And continuing down, you also have FAQs. So we are keeping this updated of questions that we receive, and you can click on the question to view the answers. And down at the bottom, you can view additional questions as well. So you can click on the user guide or the FAQs if you need any support. You also, of course, can reach out to the HRSA Customer Support Center or your project officer if you have any questions. Okay. So we're almost through everything. Just want to go over a few reminders here and then some helpful resources. So first reminder is that your uploaded file must be a JSON file. So make sure, again, before you try and upload a file, it is in JSON format that you generated from RHDT. Again, as I mentioned when we were walking through the system, it does not autosave. So make sure once you've uploaded your file and put all your information in that you are clicking next to save your work. The system will time you out after 15 minutes of inactivity. So if you are in a meeting or have to step away from your desk, just make sure that you've clicked that next button to save anything that you've uploaded. You also have, once you submit your performance report, you're not able to make any edits to the data unless the HRSA project officer requests changes. So make sure you've triple checked that information before you submit it. And then if the HRSA PO does request changes, you'll want to make sure you click that submit button to resubmit it for them to review again, because it will not automatically go to them. And last, again, we have lots of helpful resources for you. So once your performance report is open, you will be able to access that user guide as well as FAQs. We have the information in the slides here for the login.gov customer support team. So if you have any issues with your login.gov account, you can reach out to them directly. And again, just a reminder, you do not need to create a new login.gov account. You'll be able to use the same information that you use when you log into the HRSA electronic handbooks or EHBs. We have the information for the HRSA customer support team here as well, if you need to reach out to them for any questions or issues you may run into. And of course, your project officer is always available to help you as well. So lots of available resources. We will share the recording as well as the slides after the webinar, so you'll have access to those as well. It does take a little bit of time to get the recording put together, so be a little bit patient, but we will absolutely have that out to you before your performance report opens on August 1st. All right, so again, I know that's a lot of information, but we just want to make sure you get a good feel of what the system looks like, how you'll upload your files, what to do if you get any errors. So I will open it up. If there's questions, you're welcome to put them in chat, or if you want to unmute, you can unmute as well. So again, you can use the chat option within Zoom if you have any questions to put in, or you should be able to unmute yourselves if you need as well.
Thanks, Jenny. I have, this is really, really helpful. This is Kirsten. I guess I'll turn my video on for just a second. I just wanted to provide a little context. I did put it in the chat that us as the BLDRC will continue to help clinics prepare all their data up through the point of an error-free JSON file, and that we haven't typically been in danger of exceeding that 10 megabytes for any grantee in past years. So I don't think, hopefully we won't have any issues with size from any one of our grantees, even including all of the West Virginia clinics combined. So I just wanted to add that as well.
Thank you. That's super helpful, and appreciate you helping them as they're working on their data. And Crystal, I appreciate your comment. That definitely just made me laugh. Usually I try and hide all of the Teams and emails, and I didn't this time, so sorry about that. Any other questions or anything anyone wants to add or see again?
For some of our grantees that have multiple sites, can we confirm that they're able to upload multiple JSON files without error?
Yes, you can include multiple sites and multiple patients for the same site. It will just work just like what you had in the classic system. But in case the file that you are trying to upload is large in the size, we do recommend that when you are preparing the CSV files for the RSDT tool, you separate it by clinic or by patients. Either way works.
Perfect, thank you.
Great question. Okay, we'll do one last call if anybody has questions or anything to add. All right, looks like we are good. So we'll give everybody some time back in their afternoon. Thank you again so much for joining us. I hope this was helpful. And again, on August 1st, you'll receive that email letting you know that your performance report is set up, and you'll have that link to log into the system. So you'll see that on August 1st when everything opens up, and we'll get all of these resources out to you, the slides and the recording before then, so that you have them available when you go in to work on your performance report. But thank you for joining us, and I hope everyone has a great afternoon.
Thank you.
Thanks so much.
Thank you, everyone.